morning, everyone, and thank Flavia for the kind introduction. And it's my great pleasure to be here. And thank you for the invitation to NNI Symposium. It's very important for us. 101 is the new beginning, like in the university and in college. 101 lesson is the new beginning. I think that after the microbiota, we evaluated everything related with the nutrition. My part is very easy comparing to other speakers because majority of our pediatricians and everybody believes the breastfeeding is the case strategy to prevent everything. Today I will talk about the breastfeeding strategies, human milk microbiota, and there's some beneficial effects for the mothers and the infants. And during the preparedness of this presentation, I asked the artificial intelligence, please describe the photo, interactions between the mothers and the baby with human milk. And as you can see, this photo is made by the artificial intelligence, by Midjourney, and describe the interactions between the mothers via microbes. Yes, we well know that breast milk is a gold standard for the nutrition of the babies, especially below 6 months of age. WHO recommends the only breastfeeding during the first 6 years of life and continue the breastfeeding during the first 2 years of age with other foods. And we well know that there are some bioactive compounds available in the human milk, and it's very important for mothers and also the babies. This is like a two sides of the coin. Breastfeeding has some beneficial effects of the infants. We are pediatricians, we are focused on the childhood, and we well know that breastfeeding reduces some disorders, and we need to also highlight that the importance of breastfeeding on the maternal side. You can see that at the children's side, we well know that there's observational studies shows that breastfeeding reduced to infectious disease, reduced to type 1 and type 2 diabetes, obesity and metabolic syndrome in children and adults and older people, and also reduced to allergic disorders, autoimmune disorders, inflammatory bowel disorders, malignancy. 3 years ago, there's a good observational study shows that breastfeeding reduced the risk of leukemia in children. And in the neonatal period, the breastfeeding reduced to necrotizing enterocolitis and sudden infant death syndrome. And also, at the end of the day, breastfeeding reduced to childhood morbidity and mortality. And also, we well know that the breastfeeding has long-term consequences, long-term beneficial effects on the child. We well know that the breastfed child have a lower blood pressure and decreased risk for hypertension in adulthood, and better lipid profile, better cognitive performance, higher IQ levels comparing to non-breastfed children. And regarding the Barker hypothesis, developmental origin of the disease, breastfeeding is the case strategy to prevent every disease condition. When we focused on the maternal side, there's a good results came from different kind of observational studies, and breastfeeding shows the reduction of the type 2 diabetes in mother, as you can see, approximately 30% reduction, reduced to breast cancer reduction, reduced to breast cancer, and reduced to ovarian cancer, as you can see, approximately 37%. United Nations have some sustainable developmental goals. They categorize 7 different goals, including end of the poverty, and try to maintain a gender inequity. And breastfeeding serves all these sustainable developmental goals. If you increase the breastfeeding rates, you have a chance to end to poverty in all nations and other sustainable developmental goals too. Another important benefits of breastfeeding is reduced antibiotic resistance. We will have a lot of problems related with the antibiotic resistance in 2050, maybe then earlier period. We work in a pediatric clinics, maybe intensive care unit, neonatal intensive care unit, or pediatric intensive care unit. We have a lot of microorganisms like Klebsiella pneumonia, E. coli, Acinetobacter baumannii. Majority of these microorganisms are resistant to carbapenem or third-generation cephalosporin or colistin. We have a lot of problems related with antibiotics, and we have no new antibiotics for children. Breastfeedings have potential effects to reduce the antibiotic use first, reduce the infections and reduce the antibiotic resistance transmission between the different patients. It's very important. There's a new study shows that continue breastfeeding after 6 months confer protection against the children, especially the antibiotic resistance Enterobacteriaceae. And breastfeeding also have some beneficial effects for virus infection. During the COVID-19, we learned that there are some SARS-CoV-2 antibodies in maternal milk, and they have some protective effect against the COVID-19 disease. And we well know that breastfeeding and human milk have some beneficial effects for the protection of RSV, CMV, or other like viral disease. You can see that there are some virus that we have no vaccine available, like Zika virus or chikungunya virus, and the breastfeeding and human milk like a vaccine for this kind of disorders. You can give the human milk the newborn babies, and you have a chance to prevent these disorders related with this virus. How about the human milk microbiome? Yes, biome is a reasonably well-defined habitat which has distinct biophysical chemical properties. After the Human Microbiome Project, there are a lot of studies came about the microbiome composition, and we well know that there are a lot of factors affecting the microbiota composition. Previous speaker explained the risk factors related with the microbiota, and I highlight the importance of the woman and the mothers. You can see there are some factors related with the microbiota composition of the infant guts or human milk. Majority of factors are related with the mothers. Maternal weight gain during pregnancy, maternal weight at the first day of the conception, delivery mode, breastfeeding, maternal antibiotic use, as you can see, all related with the mothers. But there are some other factors, geography, genetic, immigration, and during the pandemics, we have some changes for the microbiota composition. As I said during my whole presentation, I try to find some factors related with the father, because I'm a father, but we found any factors related with us. Majority of the factors are related with the mothers. How about the mother's effects on the microbiota composition? There are some studies shows that if you have some risk factors related with C-section or maternal antibiotic use, if you have a chance to give breastfeeding during the 6 months of life, you can restore the microbiota composition. It is very important. Chris article published 5 years ago in Nature about microbiota-related factors shows that breastfeeding is a key indicator for the infant's gut microbiota composition. They evaluated different risk factors. You can see the maternal risk factors, body mass index, maternal probiotic, birth mode, preterm delivery. There are a lot of risk factors, vitamin D, but you can see the pink bars. Breastfeeding is the key indicator to maintain the infant intestinal microbiota. If you give the human milk during the first 6 months of life to the newborn baby, the bifidobacteria is most abundant genera in the infant's gut microbiota composition. When you perform detailed analysis, which kind of bifidobacteria, you can see that there, you can see that there are different kinds of bifidobacteria available, but the Bifidobacterium infantis is the predominant strain available in the infant gastrointestinal microbiota. These publications came from 1 week ago. This is the American Collado groups published this data. It's a very huge study. They evaluated mother-infant dyads for 2 years, and they evaluated the risk factors related microbiota composition of the infants, and they found that the strain replacement of Bifidobacterium longum over the time in the infant's gut is highly dependent of the breastfeeding duration. Yes, Bifidobacteria is very important, and changing the Bifidobacteria species are totally related with the breastfeeding duration period. Yes, the human milk includes some microbiota composition, but we should keep in mind that there are a lot of bioactive compounds available in the human milk. You can see different kind of protein, lipids, HMOs, and mRNAs, hamlet, and these factors also related with the microbiota composition too. For this reason, human milk include prebiotic as human milk oligosaccharide. There are some bacteria, virus, and fungi. For this reason, human milk include symbiotics, and their end products of this bacteria are postbiotics. For this reason, I call the human milk is a panbiotic. If we will discover new biotics, and I think that human milk includes these biotics too, like bacteriophages too. Human milk oligosaccharide is very important. More than 200 human milk oligosaccharide available in the human milk. It's very important for the human milk bacteria and also infant GI microbiota composition. We well know that human milk oligosaccharides affects the maintaining the gut immune system and gut maturation, also have some beneficial effects for the prevention of necrotizing enterocolitis and prevention of allergy. And last, we well know that the human milk oligosaccharides interacts the bifidobacterium available in the infant's gut microbiota composition. How about which bacteria are available in the human milk? This is the first study published in 2003, and we call that human milk is not sterile, but not infected or not colonized. Human milk include bacteria, virus, and fungi, and archaea, but maybe these permanent or resident are available, but it is not sterile. What is the role of human milk microbiota? We well know that if you give the human milk breastfeeding to infant, human milk affects the colonization of the infant gut microbiota, train the infant immune system, and facilitate early nutrition and metabolism. It's very important too. And you can see that there are interaction between the microbiota composition of the mothers and the infants, and there are a lot of anatomical parts of the mothers affects the human milk microbiota composition. Not only the GI microbiota of the mother, skin microbiota, genitourinary vaginal microbiota, and also the mammary microbiota affects the composition of the milk, affects the plants, including the human milks too. Which bacteria? There are 4 studies came from different geographical location, as you can see, between 2016 to 2011, between 2011 to 2016. As you can see, Staphylococci and Streptococci is the main genus are available in the human milk composition. There are some changes regarding the geography, but at the end of the day, we found, sorry, why not work? Yeah, this is the core microbiome in regarding to previous all studies about the human milk microbiota. You can see that Staphylococci species, Streptococcus species, Serratia, Pseudomonas, Corynebacterium, Scutibacterium are available in the core milk microbiome. Which factors are related with the human milk microbiota? There are a lot of factors we previously described related with the mothers. Geography affects the human milk microbiota composition. Infant-related factors affects the microbiota composition, like gender, birth weight, and prematurity. And lifestyle of the mothers and nutrition of the mothers also affects the microbiota composition. Another important factor, there are some difference between the collection of the human milk sample. Colostrum microbiota is different, transient milk samples is different, and the mature milk samples have different microbiota composition. It is very important because maternal diet affects the microbiota, and maternal diet during the last 3 days affects your human milk studies. There are shows that Mediterranean diet has some beneficial effects on the human milk microbiota composition, and maternal consumption of non-nutritive sweeteners has some harmful effects on the human milk microbiota composition. These are totally related with the maternal diet. As I mentioned before, there are some difference between the transient and mature milk. If you collected the human milk sample between 7 to 15 days, you found different bacteria, virus, and fungi. If you collected the human milk after 45 days of life, you can find different kinds of bacteria or virus. What is the origin of microbiota? It is a very controversial issue. There are some speculation about this issue. Maternal oral microbiota, maternal gut microbiota, mammary gland microbiota, maternal skin microbiota, and infant oral microbiota all together affects the human milk composition. What is the role of gastrointestinal microbiota of the mother? Theoretically, we know that gut microbiota composition transfer to the lymphatic nodes and go to the lymphatic and blood vessels and goes to the mammary gland, and they have there are transaction from mothers to infants via this way. And these different kind of speculations about the origin of microbiota shows that there are different factors affects the microbiota composition, but it's very important one is the maternal gastrointestinal microbiota. Yes, there are still controversial, because some people think that oral microbiota of the infants affects the microbiota composition, but there are some precolostrum studies. They collected the human milk samples before delivery. During the last 3 days of the pregnancy, there are no contact with the oral microbiota of the infant, and they showed the precolostrum microbiota composition. Another important issue, if you collect the samples only one time, you detect some bacteria, fungi, and virus, but you have no chance to say that these bacteria are residents or tourists. They call tourists like this in this study. We performed studies about the human microbiota composition. We collected human milk samples from the transient human milk and mature human milk, especially among 44 mother and child diets, and we evaluated the bacterium composition. We firstly showed that large for gestational age babies who have an obese mother or gestational diabetic mother have some distinctive feature of bacterial microbiota composition. You see that increased number of Ralstonia and Ralstonia piquetti, the bacteria are expressed in the subadipose tissue of the obese or type 2 diabetic mothers. Regarding the microbiome study, we found different kind of microbiome. I am a 25-year-old pediatrician. 20 years ago, if we identify Aspergillus, Candida, Malassezia-like fungus in the human milk, we call this human milk is infected. I cannot imagine, but now we found that there are a lot of different kind of fungi available in human milk and totally related with delivery mode. There are differences between the C-N section and normal delivery. There are differences between the preterm and term birth cohort, and there are differences between the appropriate gestational age, small for gestational age, and large for gestational age too. We also performed the virome analysis. We clearly showed there are same comparison between delivery mode, gestational age, and birth weight. There are clear differences between them too. What is important, the gut human milk virome and human milk microbiome? Tomorrow you have a chance to listen gut virome analysis, but I highlighted that virome is very important for the being healthy, and there are some trajectory available for the composition of gut microbiome composition, and we well known that breast milk is very important factor to maintaining healthy gut virome. But if you don't chance to breastfeeding with and you don't have a chance to give the virome composition, there is an increased risk factor for some disorders like inflammatory bowel disease, pediatric diarrhea, malnutrition, and autoimmune disorders. Maybe in the future we need to perform long-term studies to effective effects of the human milk virome content on this kind of disorders. Same situations are available for human milk microbiome. You can see there are a lot of factors related with the microbiome, and we well know that the human microbiome are related with childhood allergy, autism disorders, obesity, focal intestinal perforation, and inflammatory bowel disease. Maybe human milk microbiome has some beneficial effects for the prevention of these disorders too. At the end of the day, yes, human milk microbiota is very important, including bacteria, virus, and fungi, and there are some beneficial effects for the prevention of disorders. Which disorders? Clearly shows that there are some reduction of the infectious disease, there are some reduction of the allergic disorders, and there are some beneficial effects on the obesity. But we should keep in mind, human milk is a miracle, including different kind of bioactive compounds, not only biotics, microorganisms, there are also in prebiotics, you can see some end products, and all together, bring together to help the child with the potential effects of this situation. I try to finalize all my presentation with this slide. We highlighted the importance of the mothers. Yes, vaginal delivery is important, breastfeeding is important, but we don't criticize or judge the mothers if you have no chance to normal delivery, if you have no chance to give the breast milk, because mothers is very important. We try to increase the importance of women in the community, and we try to support them for their breastfeeding and for their normal delivery. And the last point for me, We are pediatricians, we are very important. Second half of man's life is made up nothing but the habits he has acquired during the first half. We are very important for the first half of the life, and thank you for your attention and ready for your questions. Thank you.
Thank you, Chare. And before Mario will go through the question, I just remind everyone in the audience that if you don't want to raise your hand and ask a question, please scan the QR code and send the question to Mario on the iPad, and everyone is welcome to do this.
Thank you, Fabian. Thank you, Anna, for your great presentation. I have a couple of questions here. But just to make a link with Francesco's presentation, is there any evidence to say that there's an impact of mother's age in the composition of breast milk microbiota?
There are some studies regarding the maternal age effects on the microbiota composition, but the sample size is very small. It's easy to say something because the sample size is very small now, but there are some changing. But I think that they might be related with the associated disorders related with the age increasing after the 30 years or 40 years. It might affect the microbiota composition, but regarding the humomic microbiota, there are limited information available.
Right. Thank you. Well, again, I have a couple of comments praising you for your excellent presentation from colleagues from Brazil, from Nigeria, joining us online. There's another question here on in case of donor breast milk for an infant who was initially breastfed by the mother, does this change significantly the microbiome of the baby?
There are some studies about human donor microbiota composition. It's everything changing because the pasteurization required for the human milk banking, and they reduced the number of bacterial diversity. But there are some promising results regarding the effects of the human donor milk on infants' gut microbiota. I totally agree with this situation because it's very important, especially for the premature babies. But there are still some difference between the donor milk and the fresh milk because there are some pasteurization procedure affects the microbiota composition too.
Right, thank you. And in line with this, there's another question here. If the milk is not from a milk bank, but the mother freezes at home, is there an impact if there's no pasteurization?
Yeah, but there is a good nutrient source for the babies, the freezed milk, but we know that the rhythmicity of the mother, breastfeeding time is also important to microbiota composition. You collect the humomic sample with a hand expression or with a pump, and you collect it in the freezer, but the changing time of this period might affect the microbiota composition. At the end, we need to highlight that for working mothers, they collected the human milk and freeze in the refrigerator. It's the best way to give human milk for their child. There are no clue for this situation.
Right. Flavia, do you want to make any comment?
As always, I was impressed about this, let's say, virome or fungi composition. And this is quite, let's say, new. And do you think that the virome of the microbiome, we will have a talk about microbiome, just have a specific role on the composition of the rest of microbiome, can have a specific role in the colonization of the gut of the baby?
I think that they have some promising results, but there are a lot of methodological problems to detect the virus and fungi in the human milk. Comparing the bacteria, there are some lot of issues. Maybe we'll listen tomorrow about the virome analysis, but I think that in the near future, we have some new approach for the restoring microbiota with fungi probiotics or fungi biotics or bacteriophages, and I think they resolve some problems, but we need a lot of studies, good quality studies, to evaluate the virome and microbiome composition first, and then after we selected the important strain-specific effects is very important, like previous talk, and maybe in the future we will use, but now there are no available strategy now.
Thank you. There's another question on if there are any racial differences in the infant's microbiota, ratio specific in the breast milk.
There are some similarities. Still ratios because there are a lot of factors. It's very difficult to homogenize the study population because the maternal weights affects maternal nutritional status, maternal stress affects. There are we found some ratios, but it's very difficult to homogenize these people.
Right.
And I want to highlight that the importance that sometimes we found difference between the human milk of C-section mothers and normally delivery mothers, and premature babies and term babies. We don't call this dysbiosis like gut microbiota. Sometimes maybe mothers give optimal nutrients to their baby regarding needs, their requirements. They change the microbiota composition regarding the delivery mode, regarding the birth weight, or regarding the prematurity. They give amounts of bacteria which are required by the newborn period. We don't call this like dysbiosis. We found some difference between the human milk in C-section and normal delivery. Maybe this is a natural way to prevent some conditions related with the C-section.
Right. There's another question on is there any impact of mastitis in the composition of breast milk microbiota?
Yes, mastitis affects the microbiota composition, and especially the abscess formation. Especially the abscess formation might affect the microbiota composition. Another important issue is during the mastitis, mothers require to receive antibiotics, and antibiotics also affects the microbiota composition of the mothers in gut, or microbiota composition of the gut or milk microbiota composition too.
Right. Thank you. Well, there's a question here on probably is not actually related specific to breast milk microbiota, but is the introduction of potential allergens in early breastfed babies, would this affect the microbiome?
It's a very good but very example question I need to ask to you, because this is your special area, because there are a lot of discussions between the early introduction of such foods to reduce the allergies, but for this, there are no studies showing the beneficial effects on microbiota. There are some observational cohort studies show some effects, but I think that we need some studies to evaluate this situation.
Thank you. And well, there are a couple of people saying, just praising you for your great presentation, and everyone is so excited with the importance of breast milk, and for you, and grateful for you to share all this information. Could you highlight the main difference between the microbiota of a breastfed infant and the formula-fed infant?
Previous studies is a standard formula, not included biotics. There are some difference between them. They shows that lactobacilli and bifidobacterium contents change in the infant gut microbiota composition, but there are some new infant formula, including different kind of prebiotics, probiotics, symbiotics, and postbiotics. There are still some difference between the comparison of gut microbiota of the infants, but we did now exactly the mean for this difference. Yes, we found that some increased bifidobacteria, some decreased enterobacteriacea, but what this mean for future of the babies, we need further studies for the evaluation. But when you compare the breastfed babies with standard formula babies, you can clearly see that low number of bifidobacteria are available.
Right, thank you. There's one question that always comes is actually someone asking for a practical advice on early use of probiotics in newborns that were delivered by cesarean section. Is there any evidence to recommend a specific agent to improve the microbiota?
Yeah, if you focused on the microbiota, yes, C-section babies have low number of bifidobacteria, low number of lactobacilli, and fecal pH level increased, and there are some dysbiotic states available. And potentially, if you give it some strain-specific probiotics or prebiotic to these babies, you have a chance to restore the microbiota composition. You have a chance to decrease fecal pH levels, increase bifidobacteria, and but what is next? You can increase, you can restore some microbiota population, but what is next? What is the clinical means for this restoration? We need further studies for the evaluation. Yes, we perform this kind of studies. We give some probiotics to infants or mothers or some infant formulas, including biotics. We observe some changes, some beneficial changes in the microbiota composition, and we need longer term follow-up for these babies regarding the clinical conditions.
Right, thank you. What about the nutritional status of the mother and the impact on the human milk microbiota?
We shows that maternal weight at the conception, maternal weight at birth, and maternal weight gain during pregnancy affected the microbiota composition. And the second point, if the mother have an excessive weight gain and have obesity, overweight, or gestational diabetes mellitus, and the human milk of these babies, majority are large for gestational age, there are clear changes about the bacterial composition. I try to show that there's an increased number of Ralstonia and Ralstonia piquetti. These are totally related with the adipose tissue of the mothers and totally related with the maternal obesity and fat status.
Flavia,
I want to ask you, because I know that you spoke about this, but because of the time you just skipped, and now is coming back with this paper on Nature about the role of the father on this breast milk microbiota composition. We talk because father has absolutely an incidence on the well-being of the mother. So please, Jared, tell us more.
We try to find the effects of fathers, but we did not found, but the fathers is very important for maternal side. The babies have effect on the father's microbiome too, because if the babies have an infantile colic or if the babies have some problems, the father's microbiome is totally changed. But recently in Nature paper came in May 2024, there's an my study, an experimental study, shows that the sperm microbiota is before the birth is affected the microbiota status of the offsprings, and unfortunately, father's microbiome affects the increased risk of the prematurity and low birth weight. Not beneficial effects found, but this is a mouse fathers. This is not a human. This is a
like
mouse.
Always.
This is a mouse study.
Like always.
We are still hopes about the fathers.
Yeah, fathers are important to give support to the mothers, of course, and there's a question from Chris here. Do you think milk microbes, specific strains, colonize the infant gut long-term? Many appear to be more skin-associated rather than gut.
There are some controversial issues because the staphylococci and streptococci are the skin-based microbiota composition, and the Roseburia, Bifidobacterium, Lactobacillus, and others from the gut microbiota. There are some promising results regarding the gut microbiota. Bacteria have some long-term effects on the microbiota composition, but we have still not long-term studies. We have 6 months data or 1 year's data, but there are some permanent and sometimes resident, and they call tourist and different kind of bacteria. We don't know exactly. We need further long-term studies.
Right. Thank you. There is a question on, apart from antibiotics during pregnancy, are there other medications that might affect the neonate microbiota after delivery?
In all age groups, it's very important. Proton pump inhibitors might affect the microbiota composition because reduce the pH level in the stomachs and increase the dysbiotic states. For this reason, PPI use in different age groups might affect the microbiota composition as well as in the pregnancy. And there are some studies, in experimental studies, shows that antidepressive agents using during the pregnancy to control the stress disorders might have some beneficial effects of the microbiota composition. But this is an experimental studies. I think that all drugs might affect the microbiota composition, but we need to highlight that we should use antibiotics to treat serious bacterial infections. We have no chance during the pregnancy, during the infancy. If the patients have pneumonia, meningitis, pyelonephritis, osteomyelitis, we should use the antibiotics. Yes, antibiotics might affect the microbiota composition, but we should treat the bacterial infections. Otherwise, the patient died due to infections. Because people think that antibiotics have harmful effects on microbiota, we don't prefer to use antibiotics. This is not possible. We should use antibiotics. We should appropriate use of antibiotics, appropriate dose and appropriate duration is very important.
All right, thank you. There's another question, interesting question on if you could elaborate, expand the topic about the bidirectional transmission of microbiota between mother and child.
Yes, this is very important, not only related with microbiota. If the mothers have mastitis and the children are aware of this situation, and sometimes if the infants have a serious infection, maternal immune system are aware of this situation, and there is a bidirectional interactions between this one. And I think that also the microbiota composition for the bidirectional, we have experience from mastitis, as I mentioned before, from the mastitis mothers, the transfers of the pathogen bacteria affects the immune system of the children, and there are some good changes for the immune system to treat the infections in the infant's side. There are some bidirectional effects for mainly prevention of the infections.
Right. And well, we still have time for a couple of questions. There's one question on the if there's a difference between the microbiota of infants born preterm or term.
Yes, there are a lot of changes related with the prematurity. It depends on the gestational age. You can find difference between 28 weeks of age, 28 to 32, and 32 to 36. There are clear difference between the prematurity, and also majority of the premature babies are born with a C section, and C section affects added to this baby. Another important point, antenatal glucocorticoids or antenatal steroid therapy have been used for premature babies. Another important point, antibiotic use have been used. There are a lot of factors, not only the gestational age, a lot of factors affects the microbiota composition in premature babies.
Right. There's another question on, that's an interesting question as well. What about the in mothers who are vegan or vegetarian, does it affect the microbiome of the child, the baby?
Yeah, I'm not a dietitian, but I read all of articles related with the nutrition. I found that Mediterranean diet is the best way to maintain or restore the microbiota composition. There are some changes related with the vegetarian and vegan status of the mothers and the microbiota composition. It's totally related with the vitamin status and other status. We don't know exactly there are some difference regarding the composition, but is it good or bad? We don't know any information. But we well know that if you have no celiac disease or gluten sensitivity, please, people prefer to don't eat the gluten products, and they avoid the gluten products without their gluten sensitivity or celiac disease. There's a harmful effects on the microbiota composition. In my country, there are some pregnant women don't prefer to eat gluten, including foods, and stop drinking milk, and they think that these might beneficial effects on microbiota composition, but there are no effects. There are some harmful effects on the microbiota composition.
And, well, we know that the best way to start your life is on the vaginal delivery, breast milk. But what happens if mother cannot, well, baby is born by cesarean section, mother is not able to breastfeed? Is there a way to improve the healthy microbiota in this infant?
Yes, I highlighted this issue. We have no chance to criticize or judge these women. They have no chance. It's a large baby, requires C-section, and sometimes they have no breast milk, and they can give a formula feed for their babies, and maybe some kind of formulas including different kind of biotics, and have some beneficial effects on the microbiota composition too. they follow this way, and there are a lot of information about introduction of solid foods, this kind of babies, sometimes at 4 months of age, early introduction of the solid foods. But I think that we will have a huge problem related with these. I know that in Brazil and Turkey is the number 2 countries regarding the C-section rate in worldwide, and we have approximately 60% of the mothers have a C-section, and in the near future we have a lot of babies C-section burned and no milk available, and we need some new strategies to feed these babies.
Right, thank you. Another question, for mixed feeding, is there a minimum amount of breast milk that is advisable to have a sort of healthy microbiome?
I have no idea to this. I think that there are no studies for this. It's very difficult to find how many human milk is available during the mixed feeding, but we think that every human milk drop is very important to microbiota and also the infant microbiota.
Right. And I have, I'll just thank you for your great presentation. Thank you all for joining us, and it's a great session. Thank you.